There's new technology that's been developed mostly in Europe, but also in the United States, that allows us to create 3D models out of CT scans of the shoulder that can be easily obtained, much quicker than an MRI. When we build that 3D model in the computer, you can then trial different components and achieve the best fit where you can manipulate the 3D model in a computer interface and then ask the computer to range the shoulder. And you can use different componentry and see which one gives you the best range of motion. That allows us to pre-plan the surgery, and therefore there's less trialing while we do the surgery, which decreases the amount of time that the patient is under anesthesia, decreases their blood loss, and gets a better reconstruction of the shoulder. That 3D technology can go so far as to printing a guide that allows us to specifically instrument the shoulder, which is called patient-specific instrumentation. Now, not all patients need that. Many patients have a very straightforward shoulder without significant deformity. But if a patient has prolonged arthritis or previous trauma, there can be significant deformity in the shoulder that is difficult to eyeball. And the instrumentation that you can create from these custom implants is fantastic. And I think specifically for those patients with deformity is going to allow them to have a shoulder replacement that lasts for years and years, as opposed to the ones that, if it's not completely straight, wears out a little bit early. The patients that require typically patient-specific instrumentation or a 3D model have significant deformity of their arthritis. Now, not all patients that have arthritis have deformity, and there's not a correlation between having more deformity and more pain. It's just a different type of arthritis. And those patients, we think, do better with a true model. Now, all patients you can model. It's just how different or how custom the implants are needed. And patients without significant deformity can use the standard implants at a less cost to the system, and they'll do great. Patients with significant deformity, if we want their prosthesis to last for a long period of time, I think there's benefits for using the patient-specific instrumentation, and we've done that here at Signature Healthcare.